Have you ever been worried about the security of your personal health data? With recent events like the infamous ransomware attack on the Irish Health Service executive in 2021, it's more important than ever for hospitals around the world to evaluate their IT security and business continuity measures. In the Netherlands, researchers have discovered that since 2010, the number of IT failures have soundly increased, leading to more disruption in patient care. In order to help us better understand the impact of cyber incidents on hospitals, researcher Lieselotte van Boven recently did a systematic scoping review of major acute care disruptions in Dutch hospitals between 2000 and 2020. Surprisingly, results have shown that 85% were primary IT failures, such as computer network outages and software failures. Secondary events like power failure also made an appearance, though it was found that the majority of these incidents occurred in the past decade. Emergency physician and supervisor to Van Boven, Dennis Barton said, "This skyrocketing impact seems to be attributable to the increased dependence on digital systems. The recent DDoS attack on Dutch hospitals has called even more attention to the importance of cyber awareness in the healthcare sector." Van Boven said, "Such an attack renders the website unavailable, which causes disruption. But the consequences can be far more appalling when a hospital falls victim to a ransomware attack." In order to get a better sense of the impact of such failures, Van Boven collaborated with Z-CERT and approached 25 hospitals in the US and Europe that had been victims of a cyber attack. Unfortunately, only 4 hospitals agreed to participate in the study, leading Van Boven to believe these organizations may be wary of sharing information due to liability issues, or a fear of future attacks. One of the most striking elements of the research was the amount of time it took hospitals to recover from a cyber incident. Van Boven and Barton found that recovering from such an attack could take weeks, and more often than not resulted in systems being reopened in phases. This could cause conflict between departments, each thinking theirs was the most important to reopen. Furthermore, according to Van Boven, the research found that cyber incidents also had a personal effect on hospital workers, causing extra stress and feelings of failure. Because of this research, Van Boven and Barton are looking to create a wake-up call for Dutch hospitals, urging them to become more aware of the threats of cyber incidents and begin preparing for them. They suggest having early detection systems, prioritizing applications for vital patient care, and conducting cyber crisis exercises similar to the way fire drills are done. Barton said, "We need a growing awareness within hospitals that investing in solid IT security is vital to patient care. Patients could be in danger if systems are down and in recovery for weeks, with crucial data not easily accessible." In addition, the impact of a cyber incident on acute patient care calls for solid IT systems and security. It's no exaggeration to say that the threat of a cyber attack is present in all parts of the world. So, now more than ever is the time to take preventative measures and ensure that your personal information is safe and secure.